Where's the fun in waiting? Play sit and go tournaments 24/7 only on Ace 2-3.
This game involves an element of financial risk and may be addictive. Please play responsibly and at your own risk.
Glaucoma is a significant health problem the world over. It accounts for about 75 to 80 million people who have glaucoma as of now. Most of these glaucoma patients are not diagnosed. Even in developed countries, the rate of undiagnosis is high, and in our country, in countries like India, developing nations, the number of people who have glaucoma but they are not aware of that they have it is probably somewhere around 90%. So, which is a huge a number of glaucoma patients who remain undiagnosed. And that is a big challenge for healthcare providers, for people who are working in this field. The reason for such a large number of cases being undetected are many, and but most importantly, this is a condition which doesn't have any symptoms. So, if you don't have any symptoms, why would you go, for a health checkup? And that remains the main concern. Because there are no symptoms, so people will not seek help, and they will only seek help when the disease is advanced to a stage where a lot of damage has already happened. It's important to note that the glaucoma causes irreversible blindness. So whatever vision is lost, that's lost forever, and you can't recover it by any means, including surgery. So therefore, it is very important to diagnose this condition in time. The other problem is that number one is asymptomatic, and number two, it doesn't have any, one test or blood test or one image or screening or X-ray which can give you the diagnosis. Like for diabetes, for example, if you have diabetes, a blood sugar test can give you a fairly, good diagnosis. And so is for hypertension. You can measure the blood pressure a few times and you'll know what's happening. But for glaucoma, there's no such thing as a diagnostic test. So the question is, how is the diagnosis made? The diagnosis made by looking at a number of things in the eye, which includes pressure inside the eye. Like we have blood pressure, so we also have pressure inside the eye, which keeps it in shape. So if it's too much of pressure or too low pressure, both are not good. And in case of glaucoma, the pressure usually goes up, but not always. And also we look at the optic nerve that's the inside of the eye, in the retina, where some changes happen. The damage to the optic nerve, which happens in glaucoma, can be identified clinically by looking at it, through an ophthalmoscope. But again, the problem is that when the changes are very early, they are likely to be missed. So you have to be really experienced to pick up these things. And also there are many other tests actually which are required before you can confirm the diagnosis that one has glaucoma. So for these reasons, the glaucoma is a bit difficult to diagnose early, particularly when early diagnosis is required. So for that reason, many patients, they may go undetected for a long time. And plus, there could be other reasons like accessibility to healthcare system, the lack of the trained manpower, and also certain diagnostic facilities like, testing of the visual fields and other things, or advanced imaging is required. So if these facilities are not available, again, that could interfere with the early diagnosis. The question is how we can improve the situation. To get the early diagnosis, as I said earlier, most important thing is the awareness, that people have to know about this condition and the damage that it can do to the visual field. So a patient's awareness to the public about this condition is very important. And that also underlines the fact that a regular examination periodically, at regular intervals, the eye examination, a comprehensive eye examination at regular intervals is required to pick up the disease early. Generally, this disease, glaucoma, happens, at in an age group which is like 40 plus, middle age onwards, and the prevalence goes up as the age increases. But it can happen at any stage, but typically it's like 40 plus age. So it makes sense that everyone who is 40 years of age or older should get his or her eyes checked up for glaucoma at a regular interval.